Hello, hi, good afternoon. This is Dr. Bing Yang from Dentart, Chicago. We got a lot of questions about dentures from our clients. Today, I got answer some question and hope you have a better understanding about dentures. What are the dentures? So there are a couple type of dentures. So first one, if the patient lost some of the teeth and then they do not want to do implant, so we can make partial removable denture. When patient lost all of the teeth, we can make complete removable denture. Is also when the patient has higher, better expectation about the dentures, we can make implant supported fixed complete denture. What type of a dental specialty profession you want to see with a denture? So first of all, prosthodontists, after 3 years, very strict specialty training in to make the dentures, implant supported fixed denture, and a removable partial denture. Prosthodontist will be the first number one choice for the patient if you want to proceed with dentures. So when the patient lost all of the teeth, so one removable complete denture or implant supported fixed complete denture will be recommended to the patient based on the patient medical condition, expectation, and patient intraorally the bone anatomic structure. So if patient has high expectation, implant supported fixed complete denture will be a good option. If patient want to function well and they don't want to deal with hard gum disease, caries, and then complete removable denture will have the basic function for the people. And actually, most of the people enjoying complete denture. What type of the dentures are there? So based on the implant, it can be removable complete denture, removable partial denture, or implant supported fixed complete denture, or implant maintained over denture. For conventional removable complete denture, it is made of acrylic resin. So basically, it looks very well and it looks very real, and also the strength is good. And if you want to get implant supported complete denture, so that can be made, implant on the top can be acrylic wrap around the prosthesis, or can be implant supported porcelain fused to the metal prosthesis, or can be full all ceramic complete denture. So what can be happened during the complete denture procedure? If we do complete traditional removable complete denture, so we will take impression and then make the customer tree, and then we can make perfect impression for your denture. So then this will be very important in the future to let your denture has good suction and very retentive. After impression, we will take bite records and take the tools which the shade you like or look very real for you. So the third appointment will be for the wax try-in before the prosthesis is processed. And I want you are happy and with the aesthetic and the function. And also we will check your bite, make sure your bite is at the proper position. The number fourth visit will be complete dental delivery. Afterwards, there is another 1 or 2 follow-up appointment. So if you do implant supported fixed complete denture, so that will be including based on do you have any teeth or is a fully complete denture, edentalism. So if you have the teeth, we will do a lot of treatment planning before you do a tooth extraction. to get information from your teeth, and also to build up visualize how you look like in the future before we take the teeth out. And then based on your visualized, treatment planning outcome, so we will make the surgical guide and also interim denture. So that will be helping you after implant surgery, you still have the denture to function, or implant supported temporary denture. So meanwhile, after 3 months implant heal, we can take a final impression and then make sure before uh, we will take a final impression, and then we will let you have a prototype try-in. So before you get the final prosthesis, so you can evaluate and how your implant supported fixed denture look like and how they function, properly. So after you approve the prototype try-in, so we can make the final prosthesis. So this process will take a couple months from the teeth extraction, implant placement, and to the final can be from the 5 months to 9 months based on do you need any additional bone grafting. So overall, the implant supported fixed complete denture, it will take a little much longer time, and it's about 5 to 9 months, and it will have the surgery getting involved. Overall, finish the long way, treatment, you will enjoy your final implant supported fixed complete denture. It will look great and also function well. You can clean them well, and it will be, for much more helpful to improve your life quality. Is get a denture painful? That's good question. So if you want to get traditional complete denture, you don't have any teeth anymore. So in that case, I would almost say there's no pain at all during the procedure and until you get the final prosthesis. If you want to get implant supported fixed complete denture, so basically we will do, like implant surgery, or if you still have a couple teeth, we need to take teeth out. So it can be a little bit like a painful or swelling after the surgery, which is a normal biologic, like a process, right? And then after implant healed, well, we get you implant supported temporary or fixed complete. So by that time, normally you will not get any pain anymore. So actually, I would say no pain, no gain. So for the conventional complete denture, you do not need to get anesthetic at all. Okay, because we do not need to numb you because there is no any pain for complete denture. However, if you want to do implant supported complete denture, we can do local anesthetic, which is, like numbing your gum or bone. So we can do the extraction, implant placement, bone grafting. However, if you are really, scared of the needles, we do offer oral sedation or like a general sedation, so you can be much more relaxed during the whole procedure. So that can be, we can make sure you get painless during the procedure. So what do you feel with complete denture? Again, with removable complete denture, you look still great. Okay, so I have a clients, they love the denture I made for them. It suction well, and the denture makes them look much 20 years younger. And because the denture has a good support to their, cheek or gum, so which makes them feels good, and especially when they go out for their social life. And with implant supported fixed complete denture, of course, this also because it's much smaller, so the patient can really chew well. And on the palatal part, there is no denture coverage. So that's why my patients say, and with implant supported fixed complete denture, I can feel my gum and my palatal, I can eat, I can taste the food. So that's why the life quality can be much more longer and better. But of course, implant supported fixed complete denture or implant supported or maintained retained removable complete denture, it will be much expensive than a traditional removable complete denture. Is any difficult when you talk with complete denture? So the question can be yes and no. Okay. So any person, without any complete denture experience, initially when they get a complete denture, so it takes them about normally 1 to 2 months to get used to the denture, to talk, to eat, and to chew, right? So 80% of the people after 2 months, normally they can get used to traditional removable complete denture. However, for the implant supported fixed complete denture or implant remained over denture, patient can get used to fairly quick due to the smaller volume, right? So, and also normally implant complete denture or over denture, it has a better retention. So patient can get used to it much faster, which is in, like 1 or 2 weeks, they can get used to it. So that's why like depending on the personality and also, people's habit. So I would say overall, most of the people can get used to traditional denture or implant maintained or supported complete denture. What home care you need to maintain your denture or implant supported fixed complete denture? So the first, for traditional removable complete denture, daily maintenance is very simple, easy. So you put the denture into the, polydent for a couple hours or overnight, so you can kill the bacteria on the denture. And then with your gum, you can, because you don't have teeth, you do not need to brush the teeth, but you can, do the mouthwash and to clean the mouth. If you use any dental adhesive, make sure you clean the adhesive from the gum. Okay. And then for the implant over denture, so you need to remove the denture and also soak those implant over denture into the polydent. And then for the gum, rinse and surrounding the implant locator, you may need to pay a little bit of attention to clean the food from the locator. Make sure, you don't have get any food packing or tartar around the locator. So in this way, your overdenture will function much better and longer. For the implant supported fixed complete denture, so you need to do a little bit more delicate work. Basically, I would suggest, number one, after eating the food, in 3 minutes, use water floss to clean, the denture and around the implant. In the evening, after you finish the food, using the water pick or water flosser, and then you can use the dental super floss and go under the bridge and go under the fixed complete denture and then to clean the surface. And then after that, so you want to make sure use a super floss, make a figure 8 around the implant portion. So to clean the everywhere, under the denture and the surrounding the gum. So after finish the super floss, the last part, please use mouthwash. Over-counter mouthwash will be good. And then use mouthwash for 1 or 2 minutes. So that can help you chemically remove any little biofilm. So in that case, after finish all the work, put the night guard doctor made for you so that you can have a great sleeping. So around 6 months, don't forget to see the doctor and either remove the prosthesis from the implants to do cleaning, or they will give you a special instruction to make sure you can make your implant prosthesis or complete denture clean well, and so you are free of infection or inflammation. So in this way, you can use your implant denture much longer, make your investment much longer and valuable. So how long will a denture last? For conventional removable complete denture, that can last for a couple, years, or even 20 or 30 years if you take a good care of the denture. And the denture what I made for my patient, they last 10, 20 years. And every routinely they come back, I need to check so I can do reline or proper repair for them so they can use pretty longer. And then, of course, some people, often they rack their denture into the napkin after they finish the food, or that's the all the time like people lost their denture. Or another way, they drop the denture into the sink, get a fracture. So those are, some accident. So overall, I would say, for the denture made with acrylic, that can last much longer, and 7, 8 to 10 years, and then even longer. And then if the implant is supported fixed complete denture, so if your implant are afraid of inflammation or infection, so actually that can be used much longer. Again, the daily maintenance at home, wearing the night guard, and then every 3 to 6 months go to see the doctor for the special office care. That's very, very important. So that can help make your implant supported fixed complete denture last much longer. I would say, like a 5 to 10 years, and even 10 to 20 years, that's possible. So again, make sure, you do delicate daily maintenance and yearly checkup, and do the recommendation as the doctor told you. This is very, very important to have your implant fixed complete denture, last much longer. What a denture costs, and is that insurance covered procedure? First of all, for the traditional complete denture, it is a removable complete denture, and most of the dental insurance cover them. And then also you have the opportunity to get another pair of complete denture after 7 or 8 years. So your insurance will cover for another pair of new denture. And for implant supported fixed complete denture or implant maintained removable complete denture, normally they are not dental insurance covered procedure. So that's why you may need to save money or use your retirement funds and to do the investment. So make sure your remaining lifetime, so you can have a good life quality with implant fixed complete denture. So if right now you don't have any denture, you cannot chew well, and you cannot go out for the social life, or you feels like a terrible without any denture, look much older, I want encourage you, call us now. Helping you is our specialty, and make sure you have a good denture experience is our specialty's responsibility. Also, if you want to get implant complete denture, yes, please call us. Our office has multi-specialty. It's made of periodontist, prosthodontist, oral surgeon. This will be an excellent team for you to do a implant supported fixed complete denture. So we will make sure, from the initial treatment planning, and you can visualize what you look like. And also, we will give you a very detailed treatment planning so you can understand what will happen during the procedure and how much it will cost for each steps until you get the final processes. How are you going to do maintenance on that? So we will make sure you enjoy each step during the process, and also after the implant supported fixed complete denture delivery, you can enjoy the life and with good overall dental care. I hope I answered most of your questions. So if you have any other question or if you want to do any consultation, please call us 312-929-4783. We will be here to help you, to support you, and you are welcome to visit our YouTube channel or our website to see our patient testimonial to let you understand more about our Dentart Chicago team, and then what are you looking the best outcome with our office. Thank you.